let's go through and let's just kind of give everybody your feel on the situation in terms of, so we're working from home. I know Alyssa's in the office, but for the most part with our previous webinars and from what I hear, I'm speaking to other assistants and the phone calls that I'm receiving, I want to say a good 85%, 90% of practices are shut down. The couple practices that have reached out to me and told me that they are seeing emergency patients, it is a very small amount. So what happens when you guys have emergencies? Are you referring them, I guess, elsewhere? I mean, I know the emergency room is not the best place at this time, for any sort of dental treatment, but what's your take on it?
Well, I can go. I know as of right now, we haven't had anything extensive. So far, I think we probably only had one the very first time we did it. And that was like last Tuesday, but we were all in the office at that point. Nothing had been set yet. But lately now we haven't had any emergency patients seen yet. So, which is a good thing also.
Right.
But as of right now, if it's a really big emergency, we are still seeing them, at least getting them evaluated. We are wearing, I know right now we have a N95 mask and level 3 mask, and we are taking the precautions to at least make sure the staff is, protected as well. But as of right now, we haven't had anything big, or at least haven't seen any patients yet.
Got it. Well, that's great news. Absolutely. And Alyssa, how about your office?
So next week we'll start seeing emergencies again. With the criteria that we were given last night, there's, some restrictions, like it has to be a true emergency, like trauma, swelling, even uncontrollable bleeding. And then we have to also screen the patient over the phone. This is to be done over the phone. Or we actually, this past week, we actually set up like virtual, so we can do virtual consults on the phone with our patients. So once we actually, verify that it's a true emergency, then we go into kind of screening them for the virus. And then we kind of go from there. So I think that's kind of what we're going to start doing next week. We're going to see, how many emergencies we actually get and kind of try to put them maybe all on the same day. If it sounds like it's not a true emergency, then unfortunately we'll have to turn them away, which has been really hard. Just from me working a few days here this week, like on Monday, I took a few phone calls, and that was probably one of the hardest things I've done in a while, was to tell the patient I couldn't help them. I had a patient tell me that he was swollen, and I had to tell him he had to go to the emergency room. So that obviously was super hard for me, and I shed a few tears, honestly, because I felt helpless. And I didn't agree with the decision at all, but that's all I really could do.